Kids or parents see their kids off to the school bus. They wonder how long before their child comes back with an infection.
Will it be 2 days? Will it be 1 week? Dr. Madan Kandula is here because fall and back to school season is also sinus infection season. And coming up next week, I know you have a free seminar presentation that's public for people who suffer from chronic problems to get their questions answered, which is great. Let's just start talking about why this time of year so many more people tend to experience these problems and more sinus infections.
It's kind of two things on the same wavelength. It's getting colder outside, kids are back in school. When kids are back in school, they're around each other, they're kind of passing all that junk back and forth, all the viruses, colds, all that sort of stuff. They bring them home. Everybody's sort of more around again in the house and even at work, and then it kind of gets passed around. And so for some folks, you know, a cold is never fun, but then for some folks who are prone to sinus infections, those run-of-the-mill colds turn into infections like that, and then they're off to a whole new, start of trouble. So that's kind of the lowdown.
Yeah.
Do you think a lot of people have that issue, where it just for them it just goes right to the sinuses?
Yeah, absolutely. So it's about 1 in 10 Americans have either recurrent infections or chronic infections that never go away. There are, I'd say, at least that many folks who have issues sinus-wise that aren't necessarily infections, but can be chronic headache issues, just chronic stuffiness issues, and they don't necessarily, it's not as obvious to them that they've got a sinus issue. And I see lots of those folks that they don't know exactly what's going on. They know something's not right. They know it's in their face or in their nose, and they come in to get it checked out, and lo and behold, it's the sinuses.
And I think a lot of times people wonder what causes it, and then will medication be the best way to treat it?
So if somebody's either having the recurrent infections, chronic infections, or those headaches, what the sinuses are air pockets around the nose that empty into the nose. When those air pockets that are bony pockets are not able to drain properly, that puts somebody on the edge of trouble, either from an infection standpoint, or for some folks, like I said, it's just that squeeze where the opening is squeezing down on them. You can feel the pressure, and it's just not fun. And so at the end of the day, though, the issue is the passageways coming out of those sinuses. And medications are great for an active infection. So if you have an acute infection, doing an antibiotic can help to calm things down. But for folks who are having repetitive infections, the medications don't really get to the root of the cause.
Yeah, and you don't want to be taking these medications all the time. You really want to get to the root of the problem and fix it. And I know a lot of people kind of opt for the traditional surgeries when it comes to sinuses. But you also, I know you kind of have more requests for people who want something minimally invasive. They can't spend time away from work. And that's the sinuplasty. Right?
Exactly.
Isn't that kind of what's been becoming more popular?
It's becoming more and more sort of established. The difference is nowadays is we can do that in the office, very low key, and it gets people a solution quickly and back up and running. We're going to show a video of what this looks like. So this is a skull, and we're looking into their nose, and what that little probe is the little catheter that I use to find the sinus openings. And what we're doing is using a lighted wire through the nose to find the opening, and it literally lights up on somebody's face. And when we're doing this, that's what I'm looking at, and that's what I see, so I know I'm in the right spot. Once we're in the right spot, then the next thing we do is we put a little balloon in there, so you can see that thing coming in, and then we put it in just the right spot, and it's an angioplasty balloon, and so tight balloon, and so what we're doing is expanding that. And what that does is it takes your narrow sinus passageway, and all of a sudden, instead of squeezed together, now we're 6 millimeters or 7 millimeters open, which is a night and day difference. And so all of a sudden, we don't have those issues where we're not having somebody on the edge of trouble as far as infections go. We're not having somebody on that chronic kind of squeeze as far as the headaches go. And it's pretty dramatic. Some people notice that right in the moment where we do it, and all of a sudden they just feel like a weight's been lifted off. And everybody, I think, really almost everybody I've done this for notices things feel like they're supposed to. Kind of hard to describe, but all of a sudden things are open. They're feeling like they're breathing better. Things are moving like they ought to. And then as we follow those folks along down the road, then lo and behold, the infections, they're not seeing them as often. If they get something, it's easy to knock out of there. It's been pretty amazing.
One of the things I've noticed is that, over the years that you've been joining us on the Morning Blend, you've done more of these minimally invasive sinus surgeries than any other doctor in Wisconsin, but you're so young. So it's like, I don't know if it just means that you're that busy, but what do you think that experience means to your patients? Because a lot of times doctors will say, if you're going to have a procedure done, go to somebody who's done it many times before.
Yeah, I mean, I think, and I guess the key to that is knowing when it's appropriate for somebody and when it's not appropriate. on one hand. So and I think that's key. I mean, if you can't offer these sort of newer techniques, then you're just not going to talk about them. And maybe that's not the right option for somebody. But if you don't really aren't comfortable with that, it's just not going to be on the table. So if there are many folks that need more traditional sinus surgeries, and I do plenty of those surgeries as well, but it's knowing who's a good candidate for what. Number one. Number two is being sort of quick, efficient, and effective as far as what we do and how we do it, and both of those things matter immensely.
I think it's great the fact that you can say not everybody's going to be the right candidate for it. And I know you've got a presentation coming up next Tuesday, not this Tuesday, but next Tuesday, where can people come in, they'll find out more about this and be able to ask questions?
Absolutely. So I'm going to do a brief presentation, but most of what I really want to do is do a back and forth. And lots of folks have sort of specific questions, general questions, different angles on things that I don't necessarily talk about when I'm here, and that's what I'm there for. That's where we're going to really try to get into the meat of the situation.
It's great.
And this is a free presentation that you're doing not tomorrow, but a week from tomorrow. That's happening on Tuesday, September 25th at 6 p.m. That's happening at the Crown Plaza Hotel and Conference Center, which is located at the corner of Watertown Plank Road and Highway 100 in Wauwatosa. It's Treating Sinusitis is the name of that public presentation, and people can register online for it, correct?
Yep.
And the website to visit to do that registration online is advent.md/event-form. And that's where you can find out more about that. You can find out more about the Sinus Center by visiting them on Mayfair Road in Wauwatosa. The phone number for more information is 414-771-6780, and the website is advent.md. Always a pleasure to have you here.
Thanks for being here.